This is such a time of crisis, of grief, of urgency. Every single one of you on this call are dealing with it in one way or another, running organizations, helping build organizations, working with government, really trying to deal with the urgency of the situations that we face while putting into place and thinking about the systems that we need as a future. It's particularly poignant to me to see all of you come in from across the globe, from, goodness knows how many countries already, to have this conversation today, because April 1st marks our 19th anniversary at Acumen, and we wanted to use that as a jumping off point for these conversations. And before we start, I just want to say thank you to every single one of you. This was an invitation-only conversation. Some of these will open up to a much larger group, but because of this anniversary, we only wanted to bring in our partners, our entrepreneurs of the investments that we've made, our fellows, our team, and alumni, super course takers of Plus Acumen, soon to be named Acumen Academy. And we really wanted to begin the conversation, and we wanted to start, as we always do, with gratitude for you. Because of you, we are an organization that has supported and helped build 125 companies. We've moved $1 billion of our own patient capital and others that have co-invested alongside of us into companies that have reached over 300 million of the world's poor. We now are a community of 700 fellows, 400 partners, 500,000 courses have been taken. And as I said, it's all based in this moral framework that puts humanity and Earth at the center, not profit, and has really been built on the kinds of principles the world needs more than ever today. And if anything, coronavirus is showing us that we need a global community that is bound by values and not divided by race or class or ethnicity or nation, that we need to focus on collaboration, not competition, that we need to be courageous enough to hold values in tension, recognizing, like every one of you is thinking about, how do we protect our families and our communities, really hold the purpose of the work that we are doing, while also ensuring that our companies, our organizations make it through this crisis. This means really, really hard decisions. And it's the reason that we exist. I was saying the other day that crisis at Acumen, and we've had many of them, makes us better. It's where we see in the world people often reverting to some of their worst instincts, but also it's a time to bring out the best parts of ourselves. And that is what makes me so proud to belong to this community, because I see it in all of you in the work that you're doing. We also wanted to start today, not just to thank each and every one of you for what you're doing, how you're doing it, how you contribute to this community, but with a conversation that is grounded in one of the most important values to all of us, which is moral imagination, the humility to see the world as it is, the audacity to imagine it as it could be, and particularly to do so in this time of crisis. What does it actually mean? And so I couldn't be more honored to have an hour with all of you in conversation with three extraordinary entrepreneurs. Erica Mackey, who is based in Montana in the United States and runs a network of at-home providers of childcare, early childhood learning, which is essential for what's happening in the world right now. 50% of their clients work in essential services. Sabrina Habib, who runs Kidogo, a company in Nairobi, Kenya, also working in early childhood learning and daycare with about 120 franchisees, if you will, that have a very different situation given what's going on in Kenya, and equally thinking about her organization and the future. And Suhani Mohan, an India fellow based in Mumbai, India, who has built a decentralized manufacturing company making sanitary napkins, menstrual health products for women, and distributing them really for the last mile. And so I'm going to ask each of the three entrepreneurs, starting with Erica, to say a little bit more about what they're doing, what their relationship is to Acumen, in just a few sentences. And then we're going to talk about their countries and how it's impacting, what's going on in their countries and how it's impacting their companies. So Erica, can I start with you?
Sure. Thanks so much for the intro and for this opportunity to connect with the entire community across the globe. It is incredibly powerful. So as Jacqueline mentioned, I'm the founder and CEO of MyVillage. So we're based in the US, and we used to say tackling the US childcare crisis, but that word seems very different today than it felt a few weeks ago. And so we make it easy to start and successfully run home-based childcare businesses. And then we make it fun and rewarding for families to find and engage with those businesses. So similar to Kidogo, where we actually franchise people's living rooms, kitchens, and backyards to turn them into a really high quality early education environment and support brand new entrepreneurs, for the most part, all women, running small businesses out of their homes, serving 6 to 12 children. And this has been an incredible time for us to really understand, and we'll I think get in later to talking about essential services, but really understand how incredibly important early childhood services and childcare is to the lifeblood of the economy, and where all these essential services, emergency workers, grocery store attendants, people who work at gas stations, janitors, have families and have to go to work, and large childcare centers are shutting, and their normal offerings are not available. And so we've been spending the last month really propping up a lot of short-term supply as well to support all the essential workforce to be able to get back into their jobs and have peace of mind when they go to work.
Thanks, Erica. And we're going to talk about what is essential and who decides what's essential and how is that impacting us as well. I'm going to turn it to Suhani next, and then go to Sabrina third. Suhani?
Hi, thank you for the opportunity, and I'm so proud that Acumen is completing 19 years now, and it's a very hard time to be. So I'll just go back 5 years ago when we started Saral Designs. Saral Designs is a healthcare social enterprise, and as Jacqueline has mentioned, we work in a decentralized setup. So for those who don't know about the menstrual hygiene situation in India, I'll just take a couple of minutes to explain what we do. So in India, less than 20% of women use commercially available sanitary napkins or any other form of menstrual hygiene products. And a lot of women, more than 40%, are using cloth rags, which are reused again and again, sometimes causing infections. Reproductive tract infections are very common, tetanus, and even death because of poor menstrual hygiene. So when we realized this, we thought that we have to make production more accessible, and we changed how the whole typical industrial manufacturing happens, from centrally manufacturing everything and distributing it to the rest of the country, which increases the cost of the product by 60 to 80% only because of marketing and distribution, to make it more decentralized, at the same time making it automatic, having all the latest technology so that every local entrepreneur who is getting into production has a same chance of competing with multinational brands. By doing so, we have 30 plus entrepreneurs who are there in India and 5 other developing countries as well, and a network of 500 women who are going and selling the product door to door. So these products are reaching the last mile. But the last 3 weeks have been fairly disruptive for us as well, because in India, pretty early on, the stance has been taken, which is fairly tough in a way that there has been a lockdown for almost a week and a half now.
Suhani,
yes.
I'm gonna get into the countries because I think I want to hear all three, but I'm just gonna ask if I can just go to Sabrina and then really open the conversation.
Sure.
I just want to get a level set so everyone understands what each of you do.
Right, sure.
Hey everyone, my name is Sabrina and I am sitting in self-isolation here in Nairobi, but I can say that I've never felt so connected to a global community as I do in this moment. So thank you so much for being here, and I feel very privileged. I am the co-founder and chief exploration officer of Kidogo, which is a social enterprise based in Kenya that provides high quality, affordable childcare to low-income families, particularly those living in the informal settlements. We work with women who we call our mamapreneurs to either start or grow their childcare micro business. And through training and mentorship and support tools, we bring their level of quality up, ensuring that children get the best start to life. And once they reach our quality standards, they have the option to become a Kidogo franchisee. Over the last 5 years, we've built a network of over 100 mamapreneurs across Nairobi, serving about 2,500 children every single day. You know, we have 15% of market share in every community as part of our systems change goal. And we had ambitious growth plans to double our impact and reach this year. And that is exactly when coronavirus hit. So interesting times indeed.
Thank you, all three of you. And this is really where, you know, all three of our countries, India, Kenya, and the United States, are hit with coronavirus. All three of us are the countries are in very different situations. The government has responded in different ways. And here's where I'd love for you to talk about what the government response has been, and this idea of you all not only working in essential services, but working with very low income, not very, but a mix of low income people who are dependent on the company's survival for their survival. And so, again, I'm going to go in the same order. Erica, if you could start, and then hear from Suhani and then Sabrina. In the meantime, if people do have questions, put it to the chat room, and we're going to try to leave some room at the end to really throw your questions back.
Sure. So it's been an interesting experience to navigate through. So in the US, we've had less clarity from our centralized leadership at a national level. And in each state that we work, each state is, you know, its own regulatory system around franchise, around early childhood, around each of the systems that we work within. And the states, some of the states that we work in, Colorado included, are really complicated regulatory states. So there's each county actually trumps the state regulation and can operate on their own rules. And so through this time, it's been a really, putting myself in the entrepreneur's shoes. So each educator who's running the business out of their home, it's almost impossible to decipher what they can and cannot do from an operating perspective. Should they be open? Should they not be open? Is it culturally appropriate for them to be open? Are they getting asked to be open by the government? Are they getting asked to be shut? And they're getting different information from different places. So it's been a really core focus for us, is to help our entrepreneurs navigate through all of the information coming at them, trying to figure out how they can make the best decisions for their families and care for their own families and their household, for themselves as business owners. And what's happened is it started off as the strictest mandates started coming from the local level. And then at a state level, people started catching up maybe, you know, a week later and started mandating, which then would roll back local mandates. So at the end of the day, it's been deemed that all childcare so far in the geos that we work is indeed essential itself. So we haven't been mandated to close our childcare services. But there's been a core focus to making sure that we're really supporting the essential workers who are in the workforce, needing to leave their homes to be able to keep the basics ticking over in our economy.
And so, Erica, you've essentially looked at how do you build resiliency into a network that is also recognizing how isolated these daycare providers can feel.
Absolutely.
And that role of accompaniment. I just wonder if you could say a little bit about that.
Sure. So one of the first things that we recognized So as I mentioned before, all of our educators are first-time business owners, and many of them are also first-time educators as well. So this is the experience that they're going, and we create all of our educator supply from scratch for the most part. So they're not people who have a ton of experience coming into this. So going through something like this is incredibly terrifying from many, many fronts. And so one of the things that we recognized in the beginning was income stability, and the ability to see a light at the end of the tunnel was one of the most important things that we could organize around as a company to provide. So we first raised, in fact, with Acumen's help, and over about a 72-hour period, raised a relief fund to make sure that we could guarantee the income for educators through the end of April if they were either had exposure in their program, if they were mandated by the government to shut, if they had under enrollment because families decided to keep their kids at home, that the income was guaranteed, their income, and that their lifeline that their families are relying on was guaranteed through this period of time. And it turns out, from our government's response, there wasn't any help for weeks. So it was would have been a period of spiraling for them. Because we were able to create that stability, we could actually shift their mindset into a space where they saw a world of possibility, and it reignited what has always been there for them, this sense of service to their community. And it was incredible to see. We had, we've had weekly calls with our educators every Sunday with all of their kids from their own families piling in, gathering to talk about, questions on any policy changes or how the challenges that they've been going through. But really what was a shared sense of, like, we have the ability to keep the economy, our local economy going, to keep our neighborhoods moving, and we will do whatever we can to do. So even though they're taking in, emergency medical staff families, which increases their exposure risk, vast majority of our programs raise their hand to say they'll fill vacant spots with extra children. They were just overwhelmingly connected and motivated by each other because they had that sense of security that they could rely on.
Thanks. And what you're really raising, I think, for the whole Acumen community is, we've always understood that patient capital, even patient capital as an investment tool is not enough, particularly in crisis. And what is exciting to me about our global community is how do we help each other tap into government resources, philanthropy, so that we can fill these gaps, and also scrappiness and moving fast, which I want to talk about a little later too. So Erica mentioned, in the United States, we've got such a belief in freedom as our primary value. And right now that's being tested during this crisis, where a national strategy is so important to staving the health crisis that we're dealing with. And given that you are working across different states, you're right at the heart of it. Suhani is in a country that is taking absolutely the opposite approach. And as a result is seeing probably the largest mass migration of workers in history, including maybe during partition, and wild displacement of the lowest income workers, and you are getting hit by that as well. So Suhani, could you say a little bit about India, essential services, and what has it meant for you as someone who has really tried to disrupt capitalism and serve some of the truly most vulnerable women in the country while you keep a company open?
Yes. So I think in India, we realized a little late that coronavirus is also a global problem and not just a Chinese issue that will get resolved by itself. So when the realization came in, and of course, we already know how much GDP we really have on our healthcare system, and how the infrastructure is not ready for a mass pandemic. So a very, very strict decision was taken that everything will go under lockdown. And the issue was that it started with, there were some exceptions that were given in terms of essential services, essential goods that will keep running, but that did not percolate to the people who were enforcing the law, like the local policemen. and they would resort to violence as soon as somebody would come outside of their house. So there were so many cases where people who were a part of our the distributed manufacturing network, or people who want the sanitary napkins, they were so scared that we are not coming outside of our house for delivery because we'll get beaten up, and there are these videos which are circulating. So there was a lot of fear that was used to control people. And now I don't want to comment on whether that's the right thing to do or the wrong thing to do, because we are just not ready for a mass spread of the pandemic. But gradually, after like a lot of weeks of effort from everyone in the menstrual hygiene community, sanitary napkins is finally included as an essential product, and now manufacturing is allowed. So some of our manufacturers are getting back to manufacturing, but our distribution network is still a question, because we had a lot of informal women who were a part of the distribution network who were trained especially for this. So they are not typically trained on how to handle social distancing, hygiene, etc. at the time like this. So government has restricted all other forms of distribution. So we really have to rely on pharmaceutical distribution networks or government distribution networks, which is going to be a challenge that we're still figuring out. But one pivot that we had, Jacqueline, do you want me to talk about it right away?
Yes, please.
Yeah. So one thing that we were observing for the last couple of weeks, even before the lockdown, was a lot of people was calling us and asking, are you making masks? Are you making surgical masks? It's so similar to, it's in the hygiene industry. And then we realized, okay, let's do something about it. We can really meet the shortfall through decentralized manufacturing. Same thing, like sanitary napkin supply. And the moment we started designing, there was a complete lockdown, and all of our engineers were in different cities. And we were like, this is a hardware product. We have to be together to manufacture it. And I spent a week going around police stations, collectors, everyone, who to get this approval from, how do we really get started. And eventually we got certain approvals, and now we partnered with a large automobile company, Mahindra & Mahindra, for they have graciously offered us their automobile factory to produce masks over there so that we can meet the shortfall. So it's been a roller coaster ride in terms of how we are handling the crisis ourselves. So this is for our internal company, but as next steps, we're thinking that this whole decentralized mass manufacturing model can be given as an add-on to our entrepreneurs, so they can sustain their businesses and meet the shortfall of masks in their communities as well.
So first of all, congratulations, Suhani, because that just happened this morning or last night.
Yes.
So again, this moral imagination plus scrappiness, as Erica says. That's super exciting that you've done that. Just so people can understand, because you're talking about kind of mini factories. And you have employees that work with you in terms of the manufacturing. You also have how many distributors in super rural and often dangerous and isolated areas? How are you thinking about that? The people you employ, and then the distributors themselves at this moment.
Yeah, so our manufacturers are there in like tier 3, tier 4 towns, and collectively we are employing, when we put everyone together, there are 150 plus people who are employed in these mini factories. So for the last week, because there was no clarity, everyone had shut down production. Luckily, there were no layoffs yet, because everyone was hoping that sanitary napkins will be back into being categorized as essentials. So this week onwards, a lot of people have got back into manufacturing, but distribution still seems to be a challenge. So we are trying to make local introductions with the government networks, whoever we can find, so that their distribution doesn't get affected. At the same time, like I mentioned, we are seeing how we can upgrade these machines and just raise some grant capital so that they don't have to further invest money when they're completely running out of capital in this time, so that they can also start a mask manufacturing, which is much in demand in local communities as well, in local hospitals, and everyone who still has to work as a frontline worker.
Thanks. And last question is on the idea of now going to an automobile manufacturer, using their factory, converting your machines and getting people physically into that factory in and of itself feels like an an enormous act of the moral imagination in action. How are you doing it? What does that look like?
The automobile factory is pretty large. So we had identified 4 to 5 people even before this partnership happened that we may have to arrange for space for people to live in the factory. And we had gotten a lot of like food supplies and everything for them. But now luckily it's happening at a much better place. So these 4 members of our team were asked to stay in isolation for a while so that they don't contract infection. And now they are going to stay there and carry on the production so that the supplies for our doctors and our healthcare workers can be met in the time of crisis. But it's a very good collaboration in terms of design, help, fabrication. All their factories and like large scale machines are open for us to make smaller parts so that we can run these mini production units.
Well, congratulations. Very cool. Sabrina, Kenya is in a completely different situation. Not a lot of cases of the virus, and yet, and not a full curfew, but lockdown. You're also impacted about essential services, even though your work is quite similar to Erica's work of critical daycare for some of the most vulnerable workers in society. And so what's happening in Kenya? What are the biggest challenges and how are you dealing with it?
Yeah, so we're about 2.5 weeks in to this crisis. That was when our first confirmed case was identified. And I think what I have just found so interesting is just how fast things are moving. So 2 days after that first confirmed case, the president announced that, among other things, all schools needed to be canceled effective immediately. And this was a Sunday evening. And I think watching other places around the world, I've appreciated the proactive nature that our government has taken, but also in terms of execution and all the scrambling that is done on the back end to try and figure out how to take those directives and put them into action have been very interesting. As at today, we have 59 confirmed cases, so we're still pretty early on in the curve. I think that's an underestimate for sure, given the lack of testing kits that we have. But given the situation that we're at, I think I'm really seeing people in 2 camps. One is the camp of people who are panicking and have anxiety and are hoarding and think this is the end of the world. And the other side that believes that this isn't real, that this is a government scheme to get money, or that it only impacts, as I heard this morning, the rich people who go on airplanes and live in estates. And so there's this incredible spread of misinformation, particularly in the informal settlements where we work. And yet we know that once it reaches these slums, the impact is just going to be huge, and it'll be these populations that are disproportionately affected. And so what we did about this on day 1, after closing all of our centers and communicating to parents, the first thing we did was did an information session on what is coronavirus, and had every one of our staff members be an ambassador for the right information. Because I think, unfortunately, it's the fear and the panic that is coming from the misinformation that is actually making the situation a lot worse. And the second thing that we did after that was asked, how are you doing? We had all of our staff sit together in a circle and ask them, what's on your mind? What are your fears? What are your anxieties? And it was a beautiful moment because it felt like this peer therapy session. And I sat back and listened for what turned into an 1.5 hour long session. And from that, learned what was on people's minds and what their biggest fears are. I learned, some of my staff members who are pregnant and fear delivering in an already broken healthcare system, and now one that is that has this crisis to deal with. I learned that a lot of my staff live in the informal settlements and were reliving what they went through during the 2007 election violence, and were so scared about that. And by listening and starting with that place of listening, I was able to take in information and make decisions based on that. And so one example was giving people their salaries 2 weeks early so that those that wanted to travel to their rural homes out of the slums had the means to do so. And I think it's something that I've learned just over the last 2 weeks is that in a period of crisis, we can be so busy just doing, and there is so much power in coming up for air, taking a breath, pausing, and looking at the situation from a wider perspective. I think in the Acumen community, we talk about it as getting up on the balcony. And I think that now more than ever, we as leaders need to do that to navigate through this time.
Sabrina, how do you think, you know, in the US, when we look at early childhood care and education, you know, I have nieces and nephews that are 5 years old and are on their computers having play dates and learning. And you are in slums where your 2,500 babies, you know, 3, 4, 5-year-olds, are living in a very different circumstances. So how do you think about them as the ultimate beneficiaries of this organization that you've built that has not only created how many jobs and how many companies and
Yeah, we have
65 jobs and
5 employees and over 100 mamapreneurs who have franchisees as small business owners.
and then how many kids?
Yeah, about 2,500 between 3 months to 4 years of age.
And so would you just talk about them and talk about our most vulnerable in society and how you're thinking about them and how this network is thinking about them, given that there's a full shutdown?
I'm really glad that you mentioned that, because I think sometimes their voices get lost in this conversation. And we are a childcare organization. We put children at the center of everything that we do. And over the last 5 years, that has been in the form of providing quality childcare services. At this moment in time, the childcare market is collapsing. There's no supply, there's no demand. And yet the need for our vision and our mission, which is to ensure that every child reaches their full potential, no matter where they're born, is so important and urgent right now more than ever. And so we have challenged our team to think about how we can still support our vision in spite of COVID, and perhaps because of COVID, the opportunities that it presents. Just to give you a sense, our children, I worry about them. You know, we've got 50% of them are malnourished and receive their main nutrition from the feeding programs and nutritional supplements at our centers. Just a few weeks or a few months out of these centers will push them even worse into malnutrition, which will lead to cognitive deficits, which are irreversible after the age of 2. And so though this crisis might last a few months or a year, we might have an entire lost generation because of this time period. You know, I worry about our kids that are under the care of older siblings and may be severely neglected as their parents go and hustle to try and earn food on their table. I worry about kids that are subjected to more child abuse during times like this, when parents are more stressed, and all the child protection issues that come out of it. And while, as you mentioned, there's amazing technology and courses and platforms that have opened up their services, none of our kids have smartphones. Our parents have smartphones, or if they do, they don't have the means to buy data right now, because that's just not a priority. It's about food. And so one of the first things that we've decided to do is, if our goal is to get children to be safe and healthy and protected and engaged in meaningful play, what activities can we do for each of those areas? And so we're looking at partnering with healthcare facilities to provide supplementation that we can deliver to the severely malnourished children. We have decided to do food packs and partnered with a grocery store to get food to the most vulnerable communities. We've assembled play packs so we can have materials that can be sourced, you know, locally around toilet paper rolls, cartons, and have instructions on how to make a car or a ball or whatever it might be from those materials. And so it creates a bonding experience between the child and the parent. We're using our platforms to send information on responsive caregiving and play and stimulation and washing your hands. And so we are trying to find ways to keep the children safe and protected and nurtured during this difficult time. And I'm sure our responses and strategies will evolve as we go through this situation.
Thanks, Sabrina. I understand that you are partnering with Teresa and Kidogo and bringing food to the child care at prisons too.
That's right. Yeah, we had a partnership. So Teresa is an incredible woman, is also an Acumen and founder of Clean Start, and works with prisons. And we realized that there are 1,000 children under the age of 4 who are in prisons with their mothers right now. And so we had signed a partnership earlier this year to set up daycare centers in each one of those prisons. But given the ban on visiting prisons, we've had to shift a little bit and are now tackling that through hand washing stations and playful materials and other means.
So thanks. It's exciting to see the fellows partnering in this way too. And I know that Suhani has been supported by fellows within and across India as well. Erica, I want to go back, and I'm going to open it up to questions in a few minutes. But when we first talked last week with Catherine Casey Nunda, the head of Acumen America, you talked about so much of your experience in Africa being the reason for the resiliency and the innovation that you're seeing, that you're able to move into place and move so quickly in the US. And so that's part of my question. And also in listening to what's happening in Kenya and India, just some reflections from a global perspective to put you on the spot.
Yeah, sure. So I think, and this goes back to a comment you made earlier, when the definition for moral imagination that Acumen has put on it, the humility to see the world as it is, the audacity to imagine the world as it could be, and applying that to that resilience concept of adding an uncanny ability to improvise. I think that so I spent 12, I don't know, I think the bio was posted, but I spent 12 years in East Africa before coming back to the States, and founded and ran a solar business in actually a competitor, one of Acumen's investees.
Many of Acumen's investees.
Yeah, exactly. In anchored in East Africa, but worked in East and West Africa. And you're as an entrepreneur in that environment, there's so many things out of your control in the external world: government reactions, regulation, how you can get shut down for things that weren't a challenge yesterday, today. And there's just always this contingency planning that is almost par for the course and part of being an entrepreneur in these environments. And it's been a really interesting experience to shift that to the US, where things are much more predictable, much longer time frames. The insecurity in the external environment is definitely at a much more measured way. And so I think as we think through that uncanny ability to improvise, it's been a really interesting dynamic to watch businesses in the United States not be prepared and not come from this place of expecting things to go wrong and having 3 or 4 different game plans to be able to default to or operate or try, and coming from this experimental mindset. So I have found a lot more inspiration from international entrepreneurs that I have connected with over the years, in terms of their reactions and their ability to constantly come from a place of yes and choosing optimism along the way, that has prepared their people as well within their communities that they're serving to have a similar mindset. And then as that translates to where we're going to come on the other side of this, particularly as the landscape changes here, where there's going to be a lot less security in employment, there's going to be a shift from what used to be, longer term job placement to a much more of that hustler mentality. And we were discussing yesterday, sharing this concept of like a Kenyan East African hustler, and how many side gigs they've got going, how many businesses they've got running, and then thinking through what are the lessons to be learned for us as we prepare for the world on the other side of this. that it's not going to be this. Yesterday wasn't the same as today, and certainly 2 weeks from now isn't going to be the same, and 6 months from now is going to be a different landscape. And so thinking through how can we learn from all of the innovation that's already been happening in geos that the gig economy mindset has been so core to the building of the economy in the last 5-10 years, and how do we start to prepare for that here?
Thanks for that. Again, this resiliency networking. When you do think about the future, because I know you are someone that holds the urgency of now and does have that humility to recognize, all right, what do I have to get done to save my company, support these women so they can save their companies, so they can support these children who are so vulnerable. What should the United States be learning about how we do this better in the future, how we take care of our kids, how we build more resilient systems that have anti-fragility within them?
Yeah. Well, one big question, I don't necessarily have all the answers yet, but certainly one big question that we're thinking about is families are going to need to work. Parents are going to need to work. Their kids are going to need to be in care. As Sabrina was talking about, many, especially for low-income families, these are the only square meals that they're getting in their day is within the care of the educators that we're working with. And so there's such a core consistency to that routine. So trying to figure out, in this mindset of transition, how do we support families who can't plan 3 months in advance? That wasn't necessarily the primary design factor for most families in the US in the situation a few weeks ago. And so what are the products? How do we financially support? How do we create offerings that allow for unpredictable cash flows, as that is, and I think that is such a core element to most of the innovations that have happened within the mobile money space and all of the financial products for emerging markets recently. So I think there's a ton to draw on from that. And then in the resilient systems piece, I think another area from emerging markets that has been so community and the sense of local connection is such a core piece to, I mean, even when, microfinance started in lending groups that got together, and how that doesn't happen that way in the US right now. And so thinking through, how do we rely on our think local first? How do we rely on our local connections, communities, the intimacy for which we know each other, and improve that to be able to take risks as a centralized body to support people to rise and get through this.
Thank you for that. Wow. I'm going to ask each of you, if you could, 2 questions, and then see if we have any. Then the community's coming in with questions if they have other ones. But that same question for you, Suhani, when you hear the Sabrina and Erica, and you think about what India is going through, and you think about both the survival of Saral designs as well as what do we need to start to put in place for the future? What comes to mind for you?
I think what we do in the time of crisis also defines the way we are going to take on the future. So this is a very important time for everyone. Do we look at mass surveillance and ignore the poor and just take policy decisions so that we control one part of the disease but let other people die because of hunger, migration, and things like that? Or do we make more inclusive policies? And this is the right time for we as a nation to decide on policy changes, what is essential and what is not. At the same time, for us, we also realize that this is an unprecedented situation. I don't think any country was ready for handling something like this. And India being a large country, all numbers are much larger than if you make the same mistakes as any other country. So usually I'm pretty critical about the government, but at this time we realize that all of us need to work together. There are certain things that we can bring in. There are certain things others can bring in. So everyone is fighting, and we see this on the Acumen Fellows group that we need support here. Somebody is coming and supporting someone else. So there's so much solidarity and collaboration that's happening right now, and like large industries have opened up their gates for small companies to come and support if there's some part of expertise that we can bring in. So I think I really hope and sincerely hope that this gives new models of collaboration for everyone to be more inclusive. And just we talked about decentralization so much. I think in the future is that with decentralizing power, decentralizing finances, I think we can make communities more resilient, that not everyone has to migrate to a city to work, and have enough livelihood opportunities in their own communities. And that's the hope that I have. But I can't take my eyes off the short term right now. There's so much that's going on that we need to do, and we are.
I said yesterday when I was talking to you, I can't really talk about the last 5 years of the journey because all I can remember is the last 2 weeks.
Yes, yes.
That's beautifully said. And when I think about so many of the business models that Acumen has to offer the world, whether it's off-grid solar, where Erica bit her entrepreneurial teeth, cut her teeth, bit a lot. The whole model is resiliency, decentralized rather than big grid. And we need to get even more effective at showing the world that. And same with what you're doing with decentralized manufacturing. What you didn't say is you're also allowing all these communities where there's so low trust to create their own brands, which is not only radical, but many people would say is crazy. And yet you're doing it. And the fact that you're partnering with a company like Mahindra also shows that we need the corporates as well as government to make this next phase happen. So thank you for that. And Sabrina, also working a system with even less social safety net. India, there's a lot that is available if we can help low-income people get access to it. In Kenya, you're looking at even less. And so what do we think? What are you learning? How do you think about the future? How are you thinking about getting through it as well?
I think that there is it's very easy to look at the future with despair and skepticism and uncertainty and be anxious about that. But I think I have found a lot of refuge in the concept of moral imagination, and particularly the audacity to imagine the world as it could be. And once this all calms down and there is a new world order of how things work in each of our own industries, in our geographies, like why the heck not can this Acumen community be the ones to reimagine what the world looks like? Like, we need leaders that have this humility and this compassion and this notion of partnerships and breaking down barriers. And why don't we all step up and be the ones that shape what that future looks like? And in our specific example with childcare, as I mentioned, there will be no childcare market. All of our families are casual laborers. They are not earning any money right now. All centers have been closed down. Those centers that tried to stay open, many of them got arrested or had threats of being arrested because they were public places of public gathering. And so there is no childcare system. And while that is devastating for a founder and all of our egos of, we built this thing and we had it working and we were just going to scale it, why don't we look at this as an opportunity to say, if we need to start from scratch, why don't we start from scratch right? Why don't we start from scratch by building an effective system and by ensuring that there's quality standards and licensing and all of these other things that we've been pushing for forever. And maybe this is the opportunity and the opportunity for governments to listen. And particularly, as Erica said, the economy will take a hit and women will need to enter the economy again. And the biggest unlock for women entering the economy is quality childcare. And I think that this presents itself as an opportunity to advocate for all the things that we've worked so hard for, but in a different venue. And I think the one thing that I don't know what the answers are. I don't think any of us can predict the future. If we could, then we would all be buying stocks right now because we could make a lot of money in the future. But I do believe that in times of crisis, there is a desire to take authoritative and command and control approaches to leadership. And while those are effective in some areas and in some times, I think that if we can balance that with leadership from a place of compassion and empathy and love, and navigate through these very, very uncertain, delicate, complex times from that place, our countries, our companies, our world will hopefully not just survive this crisis, but potentially thrive through it. And that's my hope for the future.
I think you've just said our collective hope out loud, and you couldn't have said it more beautifully. All three of you, thank you so much. Many questions are coming through, and you all see them, and some of them are to you individually, but we also don't want to end without hearing from each of you. What can this community do? How do we help? And remember, there are philanthropists on this call. There are other fellows across the world. There's our team across the world. There are entrepreneurs across the world. When you think about what you most need, how can the community help?
Sorry.
Anyone of you can go first.
Sure.
Go ahead, Erin.
Yeah, I think where I ended when I was talking about, the what's coming for the low middle income family segment in the United States is an area that I would love thought partnership on with the Acumen community. What are the, to use Sabrina's words, compassionate, responsible, loving ways that we can create smart and scalable financial products for families to be able to manage through a time of transition where employment's changing, their own dynamics are changing. And so, we are a network that is balancing and really an efficient marketplace on the supply and the demand side from educators and families. And so we have the ability to do a lot of really powerful things in supporting families to get through hard times and create stability for the kids in our care. And so I would love thought partnership or any lessons learned from the broader community in ways that we can help financially support, from a financial product perspective, support families to withstand cash flow shock.
Thank you. Suhani.
So I think in the questions also this was asked. So I think there are a couple of things. One is, of course, financial, because there will be a large part of investment that would be required to convert our existing facilities to have a modular mass manufacturing setup. So either as patient debt or grant, if there are any short-term emergency relief funds which are available, we'd love to know more about it. And secondly, also like Erica mentioned, in terms of ideas and thoughts that people may have, that we have a set of women in different villages. How do we engage them? How do we ensure their livelihoods? What are different models which probably other fellows and entrepreneurs would be working on that we could learn from? So just happy to hear more ideas on that.
Thanks for that, Suhani. And Sabrina. I have lots of questions around data for you. Can people help buy you data?
Absolutely, that would be amazing. We've got a lot of families and a lot of people that need it. I actually think that the big telcos should unlock free Wi-Fi and data, particularly for the informal settlements, to stop the spread of misinformation and use it as an opportunity to educate. So if anyone has sway with the big telcos in East Africa, that would be great.
Well, the Acumen team has a few phone calls we could make for you, so I'm hoping East Africa is on the line.
The other thing is, what we are doing is we are childcare experts, and we have 100 million different ideas on how to keep your child engaged at home using very limited to low cost activities. And we're using our own Facebook pages and our SMS and WhatsApp platforms to get that message out. But I would love additional platforms to be able to do that, whether it's radio or TV or print media, so that those ideas and tips are getting to the poorest of the poor in East Africa. And then I think that we need to band together as a community. This is not a time of competition, it's a time of collaboration and partnership. And whether that is actual services and organizations, or whether it is simply to just be there and provide hope for one another. Because this is going to take a while, and the ramifications of this crisis are going to extend even longer. And I think our biggest issue as leaders navigating these difficult times is our own burnout and our own energy. And so if we can find a way to keep hope alive through these months, we all will figure out the rest. But it's how do we keep ourselves and the spark within ourselves lit up, because we're all smart enough, we're all humble enough, we're all compassionate enough to be able to navigate through these times ourselves. We just need to keep that hope alive.
You all three are just so beyond extraordinary. And when I first called all of you, I said I've been invited to so many gatherings where the purpose was to connect. And while I have an urge to connect, I have this greater urgency around thinking about our community and what we can do and how we help each other. And Sabrina, you also said to make sure we also are getting on the balcony and bringing a real perspective to one another about how we do, what we do, how we think about the future. And that you took this time from all that you are undertaking is extraordinary. That you were doing the work that you were doing makes us prouder than I could possibly say, that we get to be part of you and that you're part of us, and everyone wants to help. So thank you, each of you, for the just astonishingly powerful work that you're doing, and Godspeed for how this continues. For everyone else, I could be talking to any of you in this conversation and know the amazing things that you each are doing, and want to just honor that and hope that we can bear witness and we can collaborate and we can celebrate what you all are doing. In my last minute, we didn't have time for voice questions, and we're going to hope to bring those in the future. Probably have conversations with just two people, because an hour isn't very much time, so that we can hear from the community. But you've done such a great job with chats, and all three of our speakers are going to be able to interact with you directly. But I'm going to ask all of you on the line to one word of an aha in the Acumen tradition that you're leaving with as well. And to say that because this is our 19th anniversary, we wanted to mark this week with two conversations. Really today, the three entrepreneurs who represent moral imagination, inaction, and scrappiness, and the beginning to what we hope to bring to the future, which is a different kind of framework, a set of principles that we believe that we need not only in crisis, but for the world that we want to create. So I'll be speaking with Carrie Solkowitz tomorrow. He's a long-term Acumen advisor on moral leadership in the age of two pandemics, the coronavirus and anxiety. And you could hear us in our conversation today talk about anxiety and the companies that these three are creating and enabling, holding our own companies and nonprofits and helping them survive and thrive, and thinking about the communities in which we serve, which are undergoing incredible stress. But we're in it collectively, and as we say, there's nothing more radical thing that you can do than create hope. So thank you all for coming today. Thank you to our speakers. Thank you for showing up. Happy anniversary, Acumen, and true wishing all good things to each of you in this moment. We're going to get through it together, and we're going to show the world what it means to shine. Take care, everyone.